Good morning, everyone. Can you hear me in the back? It's good. Great, wonderful. Well, it's such a pleasure to be here. And thank you all for attending. My name is Lance Becker, and I'm the chair of emergency medicine for the Northwell Health System. So, work in the emergency department. The other half of my life is as a researcher, where I have been studying essentially how to bring dead people back to life for 40 years now. And so that is my pedigree, and it is such a pleasure to have a chance to sort of frame for everyone this complicated area, this Biostasis Conjecture Symposium. So without further ado, I am going to just jump right into it, and I want to give us a map today of where we're going. And so biostasis sort of sits at the middle. I'll define it just in a little bit. But the biostasis we'll be talking about are sort of the tools that we can apply to provide biostasis right now. And those tools, very quickly, are things like artificial circulation. A heart-lung machine, everyone knows what that is, and we will sometimes refer to that as ECMO up here, so people know what our terminology is going to be: extracorporeal membrane oxygenation. Now, another item that we use in biostasis is frequently temperature control, cooling, hypothermia, and you're going to hear speakers talking about that. And then we'll be talking about drugs and sort of hypothermia drugs and cell protection kinds of drugs, the things that we might modify the circulation and the metabolism with. And so if that's kind of in the center of where our biostasis symposia will be today, we have to talk about a few other things. So I want to talk about something that's under the surface that we won't talk about explicitly, but is very much alive for all of us, and that is really this topic that I have studied for so long, which is like life, transition to death, and transition back to life. And what I'm talking about explicitly here is a full productive life to temporary death back to a full productive life, and the opportunities. And if there's one message from this whole thing, it's really that we are now on the verge of many opportunities to do a much more enhanced version of this as we move forward in the coming years. And you can't talk about life and death without talking about things like consciousness and longevity. And we're not going to talk about those explicitly, but they run as a theme throughout all of the speakers that you'll be hearing about. Now, what about uses of biostasis? Because we'll approach this symposium today in terms of where the uses would be, particularly in medical applications for biostasis. And we'll talk about it in terms of sudden death. We'll talk about it in terms of things like cardiac arrest or lethal hemorrhage. We'll talk about it for surgery or for transplantation. And we'll think about it for space travel, while we won't talk about it too much. Now, in order to understand those relationships, I think we have to delve a little bit down into some of the science of this. And so I am going to introduce two concepts because most people simply don't know about these concepts that make the whole, without this, it doesn't make too much sense. And that is the idea of oxygen and then reoxygenation injury, and the idea of mitochondria, and the idea of a mitochondrial death switch that we all have. So that's a bit of our map, and of course you can't talk about life and death and all of this without having someone who's going to center us a little bit on some of the ethics, society, who gets this, who doesn't, who pays, who decides. And so we will try in today's seminar to cover this as sort of our concept map for the morning. So diving right in, biostasis. So biostasis is really the ability of an organism to adapt or to tolerate a change in its environment, a harsh part of the environment, and it is closely linked to suspended animation and hibernation. And so what are the things that happen in the environment? We've got food and water, we've got oxygen and blood, we've got temperature, and of course the big question is, what do you do when you don't have food and water? What do you do when you don't have oxygen or blood? And what happens when you don't control temperature? And these are sort of the substrates of biostasis. And so the other way to think about biostasis is, can we simply learn better tricks from Mother Nature to better deal with some of these environmental stresses, like the lack of oxygen, so we can bring more people back to life as we try to treat them in my emergency department, medical procedures and space travel, things like that. So without further ado, what about Mother Nature for a moment here? So this is a tardigrade, and you all have them living very close to you, and they have the ability, as you're going to hear later, to actually simply live without oxygen. They can live in outer space, come back, fine, no problem. You've got, in North America, are turtles and toads. Turtles can live underwater all winter. They don't come up for a breath. Toad in the wintertime, you can take it out, bang it on the table, warm it up, it'll hop away. I'll see any of you try that, okay? Don't try that at home. You've got the mammals, the squirrels and the bears. Bears are amazing. Their heart rates can drop to 3 heartbeats per minute when they hibernate. Absolutely incredible. Again, don't try that at home, okay? You'll end up in my department. And finally, in a galaxy a long, long time ago, which is a good segue to now think a little more deeply about life and death itself as we try to resuscitate this frozen individual here. So I work in the emergency department, and I take care of lots of people who are living their life, and then, you know, as they explain to me, something bad happens, and they enter a state that is near death. And what we'll do in the emergency department is we'll come in and we resuscitate that individual, we rescue them. We use things like CPR. I hope everyone knows how to do that. Defibrillation. I hope everyone knows how to use an automatic external defibrillator. We essentially provide blood flow, and we return oxygen. And when all of that goes the way it should, that person returns to a completely normal life, and they live for years and years. Now, there is the other parameter, though, that I haven't mentioned, is one of time, okay? And our enemy in this whole process is really time, because as time moves on, something radically changes within human beings. And what we find is that that window of opportunity is just too short for us many, many times. And so as time is passing, that individual is beginning to change. And in fact, I'm going to try to argue today that to some degree, some of those cells are actually trying to adapt and to go into biostasis. Now, the reason that time is important, because what we just know practically is that at the point at which time has been a little too much time, the pathway back to life is blocked. That same things that we just did before that worked so well, they just don't work after 15 minutes or 20 minutes. And so biostasis looms large as an opportunity to bypass that blockage, as an alternative pathway to return a person to the land of the living. And so it holds great promise. So this was kind of like put together many years ago. People thought about this. And if we zoom in a little bit and now ask ourselves, what is really going on during that time without oxygen? Take a deep look at that. The part that is not controversial at all is that, for the most part, what we all do, and what I have made my living doing, is rescuing people with oxygen. That is what is going to happen across the world as people have an emergency. And we know that if you do it early, it works. Fabulous. And we also know that if you do it late, it fails. And the question is why? And of course, people told me when I started my career, well, there's a really easy reason for that, Lance. You haven't thought it through very well. And of course, this is one of these things where in the 70s, we knew the answer to this, right? It's going to get more complicated, I promise you. And the answer was simple. During that period of time without oxygen, the cells just died. That's straightforward enough. So, of course, you add oxygen back. They're dead. It's not going to work. That was actually the thesis of my first study. And this is what I thought was true. As we looked at it, it was anything but this. Not at all. What we found is that, in fact, the cells died when the oxygen was returned. Like within minutes of the oxygen being returned, the cells have an ability to die at that point. So we call this reoxygenation injury. We called it intentional active cell death or cell suicide or reperfusion injury. You're going to hear a lot of words for this. And they all refer to this phenomena that is true, that there's something that happens during ischemia, during the lack of oxygen, where when we add oxygen back, the cells will frequently die. Now, what is remarkable then is sort of the flip side, which is that means that during this period of time without oxygen, the cells are actually not dead. Not very intuitive, but I will make that case. There is now very solid evidence for that. It is still somewhat controversial. Because what it implied is that when you added oxygen back, there was actually a very active life-death switch that was being converted from life to death. And that somehow in the process of bringing oxygen back, we were flipping a death switch. Well, biologists love a good scavenger hunt. And so with the knowledge that there had to be a switch somewhere, the game was on, and very quickly biologists were looking inside cells, where could the death switch be? And it did not take long to identify the source of the death switch in all of our cells. And remember, we are all made like this. The mitochondria. And you've all probably heard about mitochondria. In the last 10 years, our ideas about what mitochondria do, how they function, have changed remarkably. And I want to give you sort of what I think is a more enlightened view of the mitochondria. Now, when we think about mitochondria, what we really think about is an organelle inside your cells. Remember, that all of you are about 20% mitochondria, okay? It's a big chunk of all of us. And what it really means is that it has two faces. It has two abilities, both of which are vital to who we are and what we are. And the first is the one that we all learned in biology. It's the happy face of the mitochondria. It's the one that gives us energy, the powerhouse. Sometimes you're going to hear people talking about ATP, the energy molecule of life. It's how we grow new cells. All of our cells come from the intermediates that our mitochondria spit out. It's how we get energy. It's how we use about 90% of our energy to produce heat comes from our mitochondria. But it also has this other face, okay, that we've learned about. And this is the angry mitochondria face. And it is the one that brings death. And we've got lots of fancy medical words for it, apoptosis. There's 7 new words that have been recently applied to this, and they're all kind of something tosis or another, all right? And the thing to remember is that the only organisms that are multicellular on our planet have mitochondria and have this death pathway. That's how important this death pathway is. It is felt to be the prerequisite for multicellular life. So thank you, Mom, for that. And it also gives us control over many, many other functions by getting rid of bad cells and doing housekeeping. So without further ado, I want to just summarize kind of what we know right now. So what we know is that in this process of trying to return people to life, the cells do not really die during this lack of oxygen. They sort of enter a biostasis-like state. And if our cells do that, and I'm going to try to argue in a minute that they do, maybe we can figure out a little better way to return them to the land of the living in the next years, learning from biostasis and Mother Nature. And what we do know is that oxygen right now provokes cell death with mitochondrial death switch. And so could we turn it off? So now I'm an audience participation part here. How long can the human brain go without oxygen? Does anybody want to, what did you hear when you learned? How many people sort of heard 5 minutes maybe? 5 minutes? 10 minutes? 10 minutes? 10 minutes? 15 minutes? 15 minutes? 30 minutes? 30 minutes? Nobody 30 minutes? Okay. I've got to tell you the most bomb-breaking paper of the decade, which is, how about 4 hours is what I'm going to suggest to you here, okay? So, restoration of brain and circulation and cellular function, hours post-mortem. This is done by Nanad Stestan at Yale. And let me tell you what he did. The first thing he did is, this is not a traditional animal experiment. He got the heads of decapitated pigs from the slaughterhouse, picked them up 1 hour after they'd been decapitated. Yeah, there they are. And I had a chance to meet with his PhD student who did that for 4 years. This took this. And then what he did is he sort of hooked up the tubing and the plumbing, and he reperfused the brains. And one group of brains was perfused with the way we would do it exactly in the hospital right now, with oxygen and blood. And a second group was treated with what I'm going to call this anti-mitochondrial death cocktail that he concocted. He didn't call it that. Here's the paper. You can go look and see what he did. It's got 30 different agents in it. There's a company. It's called BrainX. I won't go into the details, but you can check it out. And what he found is after 6 hours, the group of cells that was treated sort of normally was just gone, just dead. And the other group that was treated with this cocktail, not only did it look normal, function was returning, and I'll tell you a whole bunch of functions returned, and it was scary because after 6 hours, they saw the return of electrical function, and they stopped the experiment because they were worried about it. So that did not go unnoticed by the news. We now can say that with the right temperature cocktail to restore function, there appears to be, the brain and brain cells appear to be far more resilient to the lack of oxygen than we ever thought. And NPR picked this up, and if you want to see what the press did with this, all you have to do is Google zombie pigs, and it comes. I'm not even joking about that. So from our laboratory last year, here is the multi-drug cocktail therapy, improve survival, and we use a multiple drug cocktail, and we use a rodent model of cardiac arrest where those animals are dead for 12 minutes. That is a very, very long time for a rodent, approximately equivalent to 20 or 30 minutes for a human being. And at this point, we came in, we gave a cocktail, we do a normal group, we do a cocktail group, and what we find is terrible survival with the normal group, and actually very good, nearly 80% survival when we do a cocktail in this very difficult model. And what we can see is that when we combine these drugs using CPR or ECMO, we're able to get a restoration, and a remarkable restoration of brain function. And this is what we hope to be able to do in the future with human beings, is to package this so that at the time of a cardiac arrest, when we restore flow to a person, those drugs will flow to the brain and we'll be able to return that person to function. Now finally, just to again hit the importance of the mitochondria in this, I want to come back to a very new concept that probably very few of you have heard about, called mitochondrial transplantation. And it turns out that not only can I now transplant mitochondria into animals, you are all doing it between your cells all the time, something we just did not know mitochondria did until 5 years ago. They are constantly moving back and forth. And so we recently have experimented with this, and the idea would be is if bad mitochondria are kind of the problem child here, what happens if we just sort of replace some of those mitochondria with good, fresh mitochondria at the time that we resuscitate someone? And we are now developing that as a therapy, and when we do that in our model, again, we take our 12 minutes of very difficult cardiac arrest in these animals, we give a fresh mitochondrial injection to the animals, and what we find is a very remarkable salvage with nearly 90% survival in the group that get mitochondrial particles. And this article did not go unnoticed. We are really happy that a week after we published this, a full page in Scientific American on our paper, and you can go and read that. So let me sort of wrap up and come back to our venue today. And what I want to do is sort of describe our next 4 speakers who are going to be coming up and where they fit in here. So our next speaker is going to be Dr. Meilenstein, who is going to tell us a little bit about history of this and some of the ethics and things that have to do with society. She will be followed by Dr. Milas, who is going to talk about the uses of this for the surgical space and ECMO and cooling as something that's done every day in hospitals now, how it's routine practice. We will take a break. After the break, Dr. Tischerman is going to tell us about the use of this in lethal hemorrhage, in people who would otherwise die from bleeding out in the street, and the idea of using ECMO and cooling to salvage those patients. And finally, Dr. Arthur, who is with us from DARPA, is going to tell us about an amazing program that DARPA started about 4 years ago on biostasis and the idea of using particularly protective molecules to protect our cells. And then we will have a panel discussion that Helen Quinn is going to moderate. And so that is our setting for today. We're going to ask that we're going to hold questions until about a 40-minute question and answer period where we're all going to come up here, and so write your questions down if you want, and we're going to be pleased to look forward to those. And it gives me now pleasure to ask Dr. Meilenstein to come up and take over.